Surgical robots in spine surgery. In this session, we will explore the various types of surgical robots, their applications in spine procedures, and the leading systems available today. Surgical robots can be categorized into three types. 1. Supervisory controlled robots. In this type, the surgeon plans and supervises the procedure while the robot executes specific tasks. An example is orthopedic robots that autonomously cut bone according to implant specifications. 2. Telesurgical robots. These robots are controlled remotely by the surgeon, often through robotic effector arms as seen with the Da Vinci surgical system. 3. Shared controlled robots. Here, the surgeon plans the surgery, and the robotic arm ensures precision by locking into a specific trajectory and restricting movement to 2 degrees of freedom. Most robotic systems used in spine surgery fall into this third category. There are approximately 6 spine robots currently available, as shown above. Among them, the Maser X Stealth Edition by Medtronic and the Excelsius GPS by Globus Medical are the most widely used, with a combined installation base exceeding 1,000 units worldwide. Let us now focus on the Maser X Stealth Edition. The image illustrates the Maser X workstation, which serves as the primary console for user interaction with the robotic system. The robot features a shoulder with an effector arm, a surgeon's screen, and a positioner. The positioner enables movement of the robot cranially, caudally, as well as superiorly and inferiorly. The shoulder is the adjustable component of the surgical system, enabling the surgical arm to move along the horizontal plane parallel to the operating table. The shoulder button is used to toggle and control shoulder adjustments. The surgical arm directs surgical tools along pre-planned trajectories. It can be secured to the patient's bony anatomy using a paired mount coupler assembly. The surgical arm also includes an integrated surface mapping camera. Using the 3D Define scan, the system calculates the work volume, ensuring the safe movement of the surgical arm. The arm guide is attached to the distal tip of the surgical arm after draping. It provides a guiding channel for surgical tools, including the knife, sleeve, drill, tap, and screwdriver with screw. Additionally, it holds the snapshot tracker and target extender with fiducials in place during image acquisition for the registration process. The arm guide is available in 2 sizes, 4.75 mm and 5.5 mm, compatible with corresponding instrumentation systems. The navigation camera, used with the Maser X system, navigation tools and trackers, provides enhanced 3D feedback on tool location throughout the surgical procedure. The camera's field of view defines the optical navigation field, while sterile spheres reflect infrared light emitted by the camera. The spatial position of the instruments is calculated using triangulation, enabling real-time navigation during surgery. Passive marker spheres are typically placed on the reference frame, and navlocks are attached to surgical instruments. These markers provide the navigation system with real-time positional data. The spheres are detected by external cameras or sensors, allowing the system to track the position of instruments, tools, or the patient's anatomy during surgery. However, the presence of blood or erosions can interfere with the function of the spheres. A minimum of 3 visible markers on any navigable instrument is required for detection by the navigation system. Our team commonly uses the robot arm-mounted reference frame, as shown. It consists of 6 arms, each with posts for spheres. Divots on the surface and sides of the robotic reference frame serve as reference points for the navigation camera during the verification of navigation tools. Other available reference frames include the Spinous Process-Mounted Reference Array, Robot Arm-Mounted Reference Frame, Mayfield Attached Reference Frame, and the Patient-Mounted Reference Frame, as shown in top image. The robot is stored attached to the manipulator arm beneath the cover of the console. This is the robot's storage state. The workstation, along with the manipulator and surgical system, is moved to the extended position, also known as launched position. Robot navigation system registration involves the use of the snapshot tracker. The snapshot tracker is placed in the surgical arm guide and screwed into position during the robot navigation registration. The system then correlates the position of the reference frame with that of the surgical arm. 4 disposable sterile spheres, recognized by the navigation camera, are attached to the snapshot tracker, 1 on each of the 4 legs. Navlocks are used to identify pre-registered instruments in navigation. Large navlocks, blue and black, are used with long instruments, while small navlocks, orange, green, gray, and purple, are used with short instruments. Trackers, which have posts for attaching reflective marker spheres, are detected by the navigation camera to track the position and orientation of instruments accurately. They are easily attachable to Navlock-compatible instruments. Depending on the workflow, disposable, single-use kits are required during robotic spine surgery. The CT Fluoro kit contains pre-sterilized robotic drapes and a star marker fiducial array. Both the Scan and Plan kit and the CT Fluoro kit appear identical externally. However, the sides of the box clearly identify the Scan and Plan kit. The key differentiator between the Scan and Plan and CT Fluoro workflows is the appearance of the star marker, which is a fiducial array. The Scan and Plan kit also includes a clear sterile drape for covering the surgical site during O-arm scans. A fiducial array consists of markers, typically metallic or radiopaque, placed on the surgical field to serve as reference points. These markers help create a coordinate system that the robotics system uses to generate a 3D anatomical model and plan its trajectories. The second most popular spine robot is the Excelsius GPS by Globus Medical, which integrates a robotic arm with navigation. We will cover more details in a separate video. ROSA One Spine combines robotics and navigation with real-time patient tracking, assisting surgeons in performing minimally invasive and complex thoracolumbar spine procedures. The Curexo robot is designed for pedicle screw placement and aims to reduce radiation exposure for both staff and patients. Brainlab has received FDA approval for two surgical robots, the Circ Spine System and the Loop X mobile imaging robot. The Circ robotic alignment module assists surgeons during spine procedures, while the Loop X is the first fully robotic intraoperative imaging device. The T-Navi robot was designed in China and is currently only available there. Thank you for watching. If you found this video helpful, please like, share, and subscribe to our channel. Don't forget to check out our other educational content for more valuable insights. Stay tuned for upcoming videos.